we have
prepared
looked
for
at
you.
the ABCDE approach, and now we're going to try to look at how we would apply our scenarios into the ABCD approach itself. Yeah, we'll try to see how we would apply the scenarios into the ABCD approach. Okay, good. So let's start. So talking mannequins, let's start with asthma. Okay. So asthma, the patient has come in with a shortness of breath. Okay. So A, what happened on A? Hello, Mr. Brown. Doctor, I can't breathe. I can't breathe. I can't breathe. My asthma is killing me. My asthma is killing me. I can't breathe. Please help me. Please help me. Okay. What you're gonna say? Since the patient is talking, the airway is patterned. Yeah. And then you're gonna go to B. Yeah. Okay, Mr. Brown, let me look at the monitor. You look at the monitor, then you tell the patient, I can see that your oxygen is low, okay, and your heart rate is high. Okay. Let me give you oxygen. So you're gonna give oxygen to the patient. Yeah. Then you're gonna take a forecast history because the patient has said that asthma is killing me. So we're gonna do the same as we discussed it. The history, the Socrates, the different, sorry, the odd para, then the differential diagnosis of shortness of breath. Okay, that is the PE, the pneumonia, the asthma, the COPD, the MI, heart failure. Okay, so I want to take a focused history. You may also see that there are some inhalers in the medications. There's some inhalers on the bed of the patient. Ask about these inhalers and ask if it's in any other medication. Then what do? You do a chest examination. Okay, what do you find? There is a wheeze on chest examination. Okay, then you're gonna give what? Nebulizer salbutamol driven via oxygen. Again, you have to apply an oxygen mask properly. Okay, good. Then what happens afterwards? Of course, you go to the circulation. Okay, so let me show you on our skeleton so that the skeleton can remain in. So our skeleton can remain intact. I'm going to show you this in the ABCDE. Yes. Let's do it using the same skeleton we have learned. Okay. I will do it on this same skeleton. So, airway in the asthma. I can't breathe. I can't breathe. I can't breathe. Please help me. Please help me. Since the airway is patterned, since the patient is talking, the airway is patterned. Then we go to B. I can see Mr. Brown. Let me look at your monitor. I can see your oxygen and your breathing rate are high. Your oxygen is low. Okay, do you smoke? And the COPD, no. I'm going to give you oxygen. You give it oxygen via another breathing bag. Do it for real. You're going to give that. Then you're going to take the history of shortness of breath. Yeah, the odd para. Then the differential diagnosis, as I said, you finish the rest of the history. You check the wristband. Then what is specific history? You're going to find the specific history is an asthma. So ask about asthma. How long have you had asthma for? Since he was the age of 5 years had asthma. What medications? I can see there are some inhalers in here. Are these your inhalers? Okay, so you can see some inhalers around the bed of the patient. Yes, they are mine. Okay, do you take any other medication other than these inhalers? Yeah, good. How frequently do you get an exacerbation of asthma? So that's our focused history. Okay, then we go to what? Examination. You perform examination of the chest. What do you find? Wheeze. There is wheeze. There is wheeze. What you give? Nebulizer salbutamol. 5 milligrams nebulizer salbutamol. You do it for real. Okay. Remember, driven via oxygen. Nebulizer salbutamol, 5 milligrams, driven via oxygen. Then what you're gonna do the test? We need to arrange an ABG and the chest X-ray. Yeah, because there was abnormalities. Then you go to circulation. Mr. Brown, I need to assess your circulation. What you're gonna do in here? Blood pressure is normal in asthma. It's not low. So your blood pressure 110/70. Your heart rate is high, 26, because he's short of breath. So he's gonna have high heart rate, tachycardia. Okay. The monitor shows sinus tachycardia, yeah, which means it's working faster than usual, Mr. Brown. Okay. The rest, you're gonna check it on normal. I still need a full ECG. Okay, that is a tracing of your heart. We're not gonna be doing abdominal and external genitalia now. It's an asthma. So after assessing the circulation, we're gonna go straight now to management of circulation. Okay, I'm gonna put an IV line, Mr. Brown, for you. send some blood testing. That's a routine blood testing. Okay, so we don't give IV fluids because it's not needed. Yeah, we have got an IV line. In asthma, we give hydrocortisone 100 milligrams IV, not 200, 100 milligrams IV hydrocortisone. That's it. So here you see IV line, bloods, hydrocortisone, IV. Then you go to D, conscious level. Okay, on an AVPU system, my patient is alert, no GCS. Take the torch, check the pupils, check the capillary glucose. They'll tell you normal, normal. Review the ABCs. What have we done so far? We have on B, we have given oxygen, we have given salbutamol, and at C, we gave hydrocortisone, 100 milligrams IV. How is the patient feeling? We're reassessing here. Okay, how do we assess in asthma? We look at the saturations. Okay, Mr. Brown, I can see that oxygen saturation is still low. It's 91%. Okay, and you are still short of breath. Yes, let me just listen to your chest. You listen to the lungs, and you can find there is wheeze. Then you step up to magnesium sulfate. Okay, I'm gonna give you now magnesium sulfate, 2 grams IV over 20 minutes. Do it for real. Go and take it from the emergency trolley. Then you go to E. So you're gonna give it about 15-20 minutes to work. You're giving over 20 minutes, 15-20 minutes to work the magnesium sulfate. In the meantime, I need just to examine you. I need to have a look at your tummy. Bear with me. You palpate, look at the private area. Okay, I also need to look at your legs and you palpate. Then I will come back. Okay, so I want to reassess your response to magnesium sulfate now. Let me look at the monitor. So I can see saturations have improved back to normal, 97%. Okay, are you still short of breath, Mr. Brown? No, I'm not short of breath. Okay, let me just listen to your chest again. I listen to the chest just on one position. There is no wheeze, which means good, we are done. But if the patient didn't respond, then we would discuss with the seniors or discuss with the respiratory team so the patient can receive aminophylline, okay? IV aminophylline. We would step up. We don't need to step up because the patient has responded well. And then we have stabilized the patient. So what's next is after stabilization, further management, okay? So we explain to the patient, you have the shortness of breath, low oxygen, wheeze on examination, okay? I suspect you have got an acute exacerbation of asthma. We have given nebulizer salbutamol, we have given hydrocortisone, magnesium sulfate, and you have responded well. What we need to do now, we keep you in the hospital, continue monitoring. Of course, we have done some investigations, blood, X-ray, ECG. We will explain the results of those ones once we get the results, okay? I'm also going to do what? Take a second opinion from my seniors. If they suggest anything different, I will let you know. So currently is to continue the current treatment you're on.